So gastrointestinal disorder, the first disease about the vomiting. So the major concern when a child is vomiting are the risks of dehydration, the loss of fluid and electrolyte, and the development of metabolic alkalosis. So for NCLEX board, question, what are the signs and symptoms of dehydration? So basically, decrease the skin turgor, dry mucous membrane, sunken fontanelle, or blood pressure go down, hypotension, tachycardia, increase heart rate, and increase the respiratory rate are the most common sign of dehydration. NCLEX board also like to ask the question, in case of vomiting, what kind of metabolic change occur? It is metabolic alkalosis. So the vomiting, basically a normal reaction of stomach as it tries to eliminate the content that irritant to the gastrointestinal system. So additional concerns include aspiration, atelectasis, and also development of pneumonia. This is a complication of vomiting. The causes of vomiting include acute infectious disease like acute infectious diarrhea, increase the intracranial pressure, toxic ingestion like food poisoning or food intolerance, mechanical obstruction, intestinal obstruction like intussusception, okay, or metabolic disorder, also psychogenic disorder. So the sign and symptom of vomiting, sign of aspiration, character of vomiters, we have to keep note, pain and abdominal cramping, the sign of dehydration, we have to evaluate, and also sign of fluid and electrolyte imbalance is important, and also the sign of metabolic alkalosis. So as a healthcare provider, we have to find out the clinical sign symptom and then categorized it is mild or moderate or severe medical condition. As I told you, diarrhea or vomiting lead to dehydration. Dehydration lead to hypovolemia, and hypovolemia lead to hypovolemic shock. So when patient come with vomiting or diarrhea, we have to categorize what kind of dehydration have, like mild dehydration, moderate, or severe. Also, how much body weight loss, level of consciousness, or capillary refill, urine output, we have to evaluate. So intervention said, maintain a patent airway or position the child on his or her side to prevent aspiration, monitor the vital sign, monitor the character, amount, frequency of vomiting. Also note the force of vomiting, because projectile vomiting is indicate of pyloric stenosis or increase the intracranial pressure. So in this picture, we can see the vomiting, and this vomiting is projectile. Projectile vomiting is the characteristics feature of pyloric stenosis or increased intracranial pressure. Monitor for intake and output and for the sign of dehydration, such as sunken fontanelle or non-elastic skin trigger, dry mucous membrane, and decreased the tear production and oliguria. So all is the sign of dehydration. In this picture, we can recap the sign. So sunken eye and cheek, decrease the skin trigger. We can examine here. Sunken abdomen, dry mucous membrane or tongue, few or no tear at all, and sunken fontanelle or sunken fontanelle. So what else? Monitor the electrolyte balance, because electrolyte imbalance can cause hyperkalemia or hypokalemia that lead to dysarrhythmia, and dysarrhythmia lead to the heart failure. Provide the oral rehydration therapy as tolerated and as prescribed. Start the feeding slowly with small amount of fluid at frequent interval. Monitor for diarrhea or abdominal pain, or reinforce instructions to the parents to use oral rehydration formulations such as Rehydrate or Gastrolyte or Pediatric. Tell the parents to contact the healthcare provider when the sign of dehydration, blood in vomitus, or forceful vomiting. Also, if patient complain abdominal pain,